All right. Well, welcome this morning, guys. I am excited to have you here and excited to introduce you to Dr. Randall. I want to say Weisel because
That's
I'm
good. It was Van Weisel. It's Weisel, but that's all right.
Weisel. Yeah. So Dr. Weisel and I met through Facebook and through things that he's posted. And then we have a mutual friend, Nicole, who said he told him he needed to meet me. And so we connected and and I am excited to share his research with you. So Randall, take it away and we'll,
Hey guys,
hear what you have to say.
thank you so much for having me and giving me the opportunity to share this information that I really am passionate about. And it's I'm a laser dentist, but we're going to be talking about mainly how to use light to recognize pathogens in the mouth, and then also inflammatory processes from the oral cavity that you can see. So with this, when we use this technology, and what you would know is a technology that looks like this called the Velscope. That's what I used. It's just a tool that that promotes LED light to expose to cause what's called autofluorescence or absorption. I'm a laser dentist, so I'll kind of have a cross over there. But what I found with some of the representations that you'll be able to see with the Velscope, these patients most likely have sleep apnea. But you have to realize that we breathe 24/7. So I've expanded this. In 40 years of being a dentist, I never treated sleep apnea. So what I did was I recognized that there are certain representations that mean that the oxygen levels have decreased in the host. And yes, it probably happens greater when they sleep, but I will tell you that one of the areas we're missing is during the day, which I call diurnal related sleep disorders. Claimer, every one of the patients that you'll see in my cases that I show, I've got a consent from them. I do have a financial relationship with a company that I founded called Laser Hygienics. It's basically, I sell Velscopes. We're going to be talking about some other technology that you probably haven't thought much about in the dental realm but in the health realm you have, and that's using ultrasound. So I have some relationships I can sell that technology, but that's not why I'm here. I'm not here to sell anything. I'm here to share what I found and I feel I've been enlightened to. And so I would like you guys, because I know that this group being biologically oriented, we're right in alignment. And I'm more on the molecular or cellular level, and we'll talk more about that. So today we're going to talk about sleep-related breathing disorders or obstructive sleep apnea, diurnal-related breathing disorders, a term that I coined, and the comorbidities related to that. I'm going to screen for another process, what I call oxygen desaturation syndrome. And I guess I'm full of acronyms, but it fit. We know with hypopnea, hypopnea process is a drop of 4% of the oxygen levels for 10 seconds or more. And again, that can happen when you sleep. But I want to challenge y'all that because we don't look at it, and probably because of the ergonomics involved in just our jobs, we kink the airway. And I know that when certain studies are presented, we're going to see that oxygen desaturation processes occur during the day. I'm going to show you how to use a Velscope and how autofluorescence in your hands as a class 3 laser light, a class 3 medical device is going to be very, very helpful along the lines with some of the things that I've heard you talk about with using the microscope and things like that. Because with AF, anaerobic pathogens will fluoresce orange and you'll be able to see them. We're going to go through case reviews, talk a little bit about ultrasound, and then we'll have a little Q&A. I'm going to step it up because I know I only have 50 minutes and I'm a yacker. I went to Wabash College in Indiana and then went to Indiana University School of Dentistry. I got a master's degree from Lynn University in biomechanical trauma, which was a distance learning program that was multidisciplinary on all aspects of trauma. And at the time, I was dealing a lot of TMJ, TMD, personal injury. So it kind of fit in, got away from that, but now I'm getting back into it by virtue of some of the medical tricks that I'm following. I have my fellowship in the Academy of General Dentistry, and I know I have the numbers for the master's. I worked in politics at the Florida AGD level. I was their membership chairman, and I was their editor of their magazine. I teach lasers, and I also teach about autofluorescence and point of care ultrasound. I always have to state, you may or may not know, I mentioned to Barbara because it's up there in her area, Amy Doneen and Brad Bales. This book, in my opinion, is a must for anyone who is looking at oral systemic issues, because that Amy and Brad are friends of mine, and I've been collaborated with them from afar, and they've been very helpful in affirming. But they're one of the first medical doctors and medical practitioners to recognize dentistry has a profound effect on systemic issues. We are the masters of the airway, not just dentists, but all the hygienists and collateral personnel. I'm going to talk to you about what I saw as a s'more type of situation, because there's a relationship between 3 technologies that I think are very important. And that would be the Velscope, use of the ultrasound. And you think, why would I use an ultrasound? It's mainly for babies and things like that. Ultrasound can be used on the carotid arteries as a screening tool to look for what's called CIMT, carotid intermedia thickness evaluations. And there are ADA codes for use of ultrasound, but this certainly can fall under the medical, if anybody's doing medical billing, because that's the key. Everybody says, well, who's paying for it? Well, the bottom line is, I really don't care as long as it's giving us valid information. The final of the triad is what's called a sleep test. That would be a home sleep test. To stay within the alignment of medicine right now. And, I've already told you that I've kind of broken out of the concept of sleep-related breathing disorders, but to stay within that realm of medicine and possibly getting some medical reimbursement for patients, if we, depending on what avenue, if they go to an oral appliance, you have to have a sleep study. And I will tell you, and later on, I'll show you some of the stuff that I've found. Whenever you see any representation of autofluorescence in the oral cavity, that may indicate anaerobic bacteria or facultative anaerobic microbes. That means the patient's systemic condition is conducive for anaerobic colonization. They all should be suggested to have a sleep study, because they're not getting enough oxygen support for all the metabolic needs that they have. Again, oxygen desaturation syndrome is a term that I coined. I've always had some pushback on by putting it out there that it's not a term. You're right, it is now because I coined it. And what that means is the intermittent oxygen desaturation that we experience on a 24-hour basis throughout our life can lead to syndrome, can lead to comorbidities. So it's a syndrome. And those comorbidities we'll talk about in this presentation. As I said, a hypopneic or apneic event is a 4% drop in oxygen levels for 10 seconds or more. An apneic event is cessation of breathing for 10 seconds or more, which most likely leads to hypopnea. So sleep apnea is something that, and sleep-related breathing disorders, upper airway resistance, we have been mandated by the American Dental Association to be part of the team. Sleep apnea affects at least up to 60% plus, and I will tell you it's more. The overall impact of this oxygen desaturation or chronic process is causes inflammation and causes infection, which is infestation of anaerobic microbes. A bacteria that steals a nutrient that we need becomes a pathogen. And I'm going to show you from what the Velscope shows is when there's autofluorescence, it's through the research that I've done and that you can do, also from references from a paper that I published and more on the way. These bacteria are getting into the bloodstream through the dorsum of the tongue. One of the young ladies had mentioned that I've tell my patients to brush your tongue. I'm going to make a real bold statement that I all want you guys just to think about. I do not feel that after 40 years of doing this and fighting periodontal disease and chronic bacterial destruction of the teeth with strep mutans and lactobacillus, that the primary areas that these bacteria are colonizing are the pockets. I will tell you, I believe that the primary area they're colonizing is the dorsum of the tongue, and then they're migrating to the pockets and the teeth. Because I vetted over 10,000 patients.
I'll pay attention to, I'll pay attention to this. I'll fix them.
Every one of the patients
Sit
that
down.
have
I want you to sit and watch
infestation
the thing. You start mine, or there'll be consequences. Do you understand?
Andy,
Yes, sir.
I don't know if that's on my end or your end.
Your end.
It's my end? Yeah, no, I don't think so. So both of these lead to accelerated aging, disease, and ultimately demise. Sleep-related breathing disorders or diurnal desaturation issues start with snoring, upper airway resistance, obstructive. Most of them are obstructive, and some of them are centralized. The dentist, we can recognize these problems and then recommend our patients to go, and that's not just the dentist, that's the hygienist, that's the team, and recommend the patient talk to their physicians that they might have sleep apnea. Most physicians will recognize the term sleep apnea. I always suggest that they talk to them about having a sleep study. Some of the comorbidities we're talking about and that you guys are very aware of are cardiovascular disease, high blood pressure, heart attack, stroke, Alzheimer's, diabetes, caries, and periodontal disease. Most cancers, thyroid problems. I'm going to make another bold statement, and I'm actually writing. Every patient who has a proven oxygen desaturation process, every patient that you'll see this orange representation from the Velscope. If you look, or if you feel right at the cricoid cartilage, there's where the thyroid organ is. Every one of those patients who have that chronically have hypertrophy of the thyroid organ, 100%. Most people, we can feel it by virtue because we lay them back and we suddenly feel our fingers up. Most medical doctors don't see it because when they're sitting up on the table, the thyroid will kind of fold under and they just think it's the cricoid cartilage or the Adam's apple. I have found through the processes of what we're talking about today, hundreds of patients who did not know they had some thyroid problems, from goiter to nodules to even cancer. And you have the power to save lives. Obviously, kidney disease, NALF, which is non-alcoholic fatty liver, peripheral artery disease, God forbid, erectile dysfunction, they're all inflammatory disorders. We're experts, we have to, as I said, the 8A position is that we should screen our patients. And then if we find anything that may represent a process like a sleep-related breathing disorder or any process like that, we are mandated, and by ethics and morals, we need to, and by the biological dentist concepts, we need to give our patients information so they can dialogue with their doctors. Some of the methods to use for screening for OSA is using Epworth scale, stop bang, physical examination. I heard Barbara talking about, I use Malapati and tonsils and adenoid size every day, or on every patient. Health assessments, I look at their medical records. Looking at their medical history tells me a lot, because most of the comorbidities of what's called metabolic syndrome align very closely with sleep-related or diurnal-related breathing disorders, or the overall picture of oxygen desaturation syndrome. I collaborated with a Dr. Robert Lustig. He wrote Metabolical and Fat Chance, 2 big books in talking about nutrition and aspect of metabolic syndrome. And he says that over 80% of the people in the world will have metabolic syndrome or will have it. And I will tell you that over 80% of the people on this planet, when you start using the autofluorescence, are going to have some representation of anaerobic infestation. Epworth scale, I'm going to fly through this because I want to get to the meat and potatoes of the whole deal. Stop bang. These are all subjective vetting tools that, when somebody says things to you, they may not remember, or they lie to you. So, recommending having a sleep study. There are 2 types. You probably already know this: an overnight sleep study, which costs about $5,000 and to somebody, and is really not easy to do. And then home sleep studies. The amount of information that you get from either one are pretty much in line. I think the sensitivity for overnight is probably about 70%. For home sleep studies, depending on your read, is right in line with that too. But neither are really easy to do. But to stay in alignment with who's paying for it, that they need to have a sleep study. That's where the waters get gray. As a dentist, if they're Medicare age, a dentist cannot prescribe a sleep study. But if they're not, you can give, and I've given hundreds of requisition forms to have sleep studies done. There are different companies. Vivos is one coming up with certain types of sleep studies that are now being validated that show some interest. They have this little ring. I'm not saying get involved with them, but sleep study or sleep dental medicine is becoming people are becoming more aware of it, especially on Wall Street. Looking at conservative target, 40% of the people, I'm going to tell you it's 60 or 70% have sleep related, but you can see that even at 40%, and to do it for a month, you're going to have at least 50 patients a month that may need your services, because I think you all really realize it comes down to getting more room in the garage. And more room in the garage is usually done by we dental professionals with the help of the team. And that means either a sleep appliance or some type of orthodontic appliance. I'm more of an Invisalign or a liner type of guy. But these patients, it's very similar to sedation dentistry. If these patients desaturate, you need to get their airway open so they can get more oxygen. Again, we're missing, a lot of people, a lot of dentists and medical doctors don't even recognize sleep or airway issues. Medicine is very symptom treating. They don't look at, and I'm a prime example, and I'll throw this out to you. In my life, I've had 2 heart attacks, 8 stents, cancer, diabetes, sleep apnea. God's kept me around for a reason, and rescue medicine really saved me, but they never ever once said, you have the opportunity to reverse and stabilize your health. And that's through some of the things that you guys were talking about: diet, exercise, environment. And I think the huge missing factor is oxygen. Those 4 are the pillars of health. And if you have your breathing, you have stem cells present, you can reverse any disease process. I have with mine, so I'm my own lab rat. Insurance is why a lot of people like, well, I'm not going to get involved, but we have to get past that, because in this ever-changing environment, it's, even if you treat it dentally, it's going to be way under, such as getting airway through a sleep appliance or Invisalign. Just telling patients about it, educating them, is going to be way less than certain chronic comorbidities that one visit in the hospital could cost them $100,000 to $1 million. So we screen, and that's what I'm going to be showing you here in a moment with the Velscope. We do not diagnose, we are screening and giving the patients information. And about 8 weeks ago, I published a paper, and it's in the Journal of Dentistry and Oral Sciences, called Autofluorescence Allows Us to Detect Early Signs of Oral Cancer and much more. Velscope has an FDA approval, marketing only, not diagnostic, to recognize certain visualization in the mouth that may be oral cancer. It lost traction because of the fact that doctors, when we saw what looked to be oral cancer, we had sent it to a oral surgeon, and it was not oral cancer. But what they did not recognize is that if you see a representation with the Velscope, if you've had any experience with it, a black area other than someplace in a vascular area in the tongue is inflammation, dysplasia, or oral cancer. None of those. Inflammation is a pathologic condition that is very serious and kills people. So when you use the Velscope, if you see a dark area, the body is showing with that autofluorescence, the body is showing you what's happening inside. So we know that there's an inflammatory condition, and then we just have to figure out why. The other thing it shows, which I'll show you is what I found, was infection. You all, if you've used this before, you can see this is an examination. As I said, it's FDA approved for signs that may be oral cancer, but in the continuum of any cancer is inflammation, dysplasia, and cancer. The Velscope uses an LED light in the 400 to 460 nanometer range, and you shine it on the mucosa. And if you see an area of darkness, that means the light was fully absorbed by mitochondrial activity of overactive cells, which are present in inflammation, dysplasia, and cancer. If you see that, then you know that's a pathologic condition that you have to just be aware of. The other thing, which I really am excited about, I kept seeing about 7 years ago, or maybe 8, I kept seeing this orange expression on the dorsum of the tongue mainly, but I saw it on teeth with the Velscope. So I asked the rep, his name is Eben Turner, national sales rep for Velscope. I said, what's that orange stuff on the tongue? Usually it's not there all the time, and it's brighter sometimes. He says, well, it's bacteria. Well, I'm a laser guy, so I use lasers to kill bacteria and promote healing. And I said, what kind of bacteria? And I said, you know, I think that's a condition that we need to look at. And so he took it back to all his powers to be. And then I saw him about a year and a half later, and he said, you know, I've told people that, you know, you think it's a condition, but all of them, the powers that I work with in the science area, just say it's an incidental finding. He said, but I think you're right. So if you're interested, go do it. So I did research on it, and I wrote my paper. And this is what I found. When you look, this is a representation in the oral cavity, and anything green in most areas of the oral cavity with the Velscope is a normal condition. If you see orange, that is bacteria that has already entered the cardiovascular system, and they have stolen iron. You mentioned tests of anemia. They have destroyed the capacity of hemoglobin to carry oxygen and glucose to the body, plus iron. They have stole glucose because that's what they're mainly, they want glucose and iron. Anaerobic bacteria require iron and glucose, and probably glycoproteins of hemoglobin. But when that happens, you're going to see a lot of your patients who have anemia or bouts of iron, or in their elements in their blood work, they will have iron deficiency at times, or their blood work will show it on the lower end. Their hematocrit will be on the lower end of normal, and their hemoglobin will be on the lower end of normal, depending on when it was taken. They will have, they'll most likely be craving or have metabolic syndrome. And I have my ideas why they crave sugar, because if sugar is stolen and not got to the body, the brain is going to tell you you're going to get sugar brain, and it's going to crave carbs because the body's not getting enough of what it needs because the bacteria are stealing it. And you'll see CO2 buildup, which causes acidotic processes of the body, and these patients will have leaky gut syndrome. They will have what is the GERD, and be on all kinds of acidotic issues because their whole environment with the CO2 buildup is acidotic. When you have an acid environment, that's what causes leaky gut, in my opinion. I'm going to make bold statements, but it makes sense because the gut has mainly anaerobic bacteria and is protected, allowing the most of your white blood cells will line the gut and try to keep the anaerobic bacteria like lactobacillus in the gut. But when the outside environment becomes acidotic, these bacteria Katie bar the door. They give the body the bum rush, and that's what's causing a lot of these perlmutter leaky gut processes and causing the microbiome connection to the brain to be in disarray. So basically, when you do use the Velscope, there are no false negatives. If you see black, there's either dysplasia or inflammation, dysplasia, or cancer. This is a picture of what you'll see with an inflammatory response. This is looking into the mouth, and you can see in the back in the tonsillar area, there's black spots back there. That's inflammatory responses in the tonsillar tissues, which is where inflammation is occurring when the patient's exposed. And you'll see that again in acid reflux. This is what you would look at without the Velscope. You turn the Velscope on, look at the dark area. On the left, there's no way you could see. On the right, that dark area was a cancer. So dark is, if it wasn't a cancer, it definitely was an inflammatory response, and you would want to know why it would be there. Bacteria colonization, how do they do it? Anaerobic bacteria have the ability, they colonize on the dorsum of the tongue, and they have an enzyme that allows them to get in the cardiovascular system almost undetected. And what they're after, as I told you, they're after sugar, they're after iron, they're destroying hemoglobin complexes and everything involved with that. And what you'll see is this. Start looking, if you use, now you don't have to use just the Velscope. There are other tools out there. Oral ID. There's one called Identify. But I will tell you, unless you do this examination in a completely dark environment with the right filters, Velscope has that, then you'll miss a lot of things. But when you start seeing this orange, just remember, these patients all have anaerobic conditions systemically, and you have to recommend, in my opinion, that they have a sleep study to validate it. Start feeling their necks. You're going to feel some hypertrophy or changes in the thyroid, because every one of the patients, I've done thousands, have some type of change in the thyroid. Why? Because the thyroid is a circuit board. It's a circuit board for all metabolism. It also requires iron to make it work. So basically what you're going to be finding is any organ that's challenged, any organ in your body that's challenged for a nutrient enlarges. Congestive heart failure, those kind of things, that's hypertrophy. The thyroid does the same thing. Many of your patients, you just tell them, I think you might have a thyroid, some things going with your thyroid, and have the doctors check it. And that's all you have to do. I always tell my patients, always, I am not a medical doctor, and I haven't been asked to play one on TV, because I have some of the naysayers that we've all come up against will say you're practicing medicine. Again, we're working within the definition of the ADA, says that we are physicians and nurses, or whatever you want to call, of the head and neck. And we should use information or tools that we know give us information for our patients. And then we give that to our patients to talk to their medical doctors. The complex that you see with the orange is called porphyrin. A medical doctor will know what that is. Porphyrin is a quaternary compound that binds to iron. When you shine the light on iron, it will fluoresce red. Another example, there are no coincidences. God is ever present. So if you're looking at it for an economic situation, you start charging for the oral screening. At one time we were doing $30, but I will tell you, even now that there are medical codes, somewhere within the $100 to $300 range once a year is not out of line for the information that it will give you or give our patients. There is a tool that is used in the medical setting, and it's called Moleculite. And Moleculite is a souped up. This is a Moleculite. Yes, I bought all the tools. Moleculite is a souped up Velscope. It is medical grade. It has FDA clearance for vetting for anaerobic bacteria in non-healing diabetic wounds. So that's why I actually, when I wrote my paper, I found the research that it was called Prodigy. And the Prodigy was a beta Velscope. It was one and the same. And it was actually built here in my hometown. So I got to talk to all the scientists who put it together. They were under NDAs, but I got enough information that this tool and this tool are one and the same. This is a medical grade. This is a good tool for what we need. Their price point is significantly different, but by virtue of being one and the same, this tool has been FDA validated to look for inflammation, dysplasia, or cancer. This tool has been validated to look for anaerobic bacteria in wounds. So that is how you can feel comfortable. It's been proven by science. This is just sound science. The dorsum of the tongue, back in last year, they did a genetic testing of all the bacteria on the tongue. Every bacteria that we fight, from periodontal disease to strep, mutans, and all those kind of things, are all present on the dorsum of the tongue. This was from NIH study. And if you want these references, they're in the paper. Barbara has it. I'll send it to you. No problem. Dorsum of the tongue. There was some research done in Italy with the Velscope that said they were able to detect candida with a Velscope. I haven't been able to substantiate that. I think with clinical trials that will come about with utilizing this tool, and from data that hopefully you'll be able to supply to us, supply to people who want to do clinical trials, or it may be us, to substantiate. Because I will tell you, this technology has all the trappings of being part of artificial intelligence utilization. You guys know that pathogens that get into the intimate media of the arteries can cause heart attacks, strokes, Alzheimer's, the whole 9 yards. These bacteria that we're seeing with this technology, we can now see it early and then make some decisions on, or give our patients information so their doctors can, look at some certain other things than just giving them a pill and say, try this, try this. Here's some of the cases. This patient, a 55-year-old female, Epworth scale. A lot of times you'll measure the neck because the neck circumference is looked at impinging on the airway. And here's what you'll see. You'll start looking for the orange. That's a moderate representation. On a 62-year-old male, 17-inch neck, Epworth scale 9. You can see that there, and all these patients had sleep studies after I saw what I saw, and they all had positive sleep studies, everyone. 45-year-old male, Epworth scale, the AHI, you can see this was heavy porphyrin that you'll see on the dorsum of the tongue. And sleep study came back mild. I will tell you, any mild sleep study, people will tell you, well, I just have a little bit of sleep problems with sleep apnea. That's like being, a little bit pregnant. If you have it, you have it. Same here, 62-year-old male, big, kind of a thicker neck. Epworth scale was low, but you can see the porphyrin on the dorsum of the tongue. Again, I want to make that very clear. I believe that the dorsum of the tongue is the primary ecosystem where the bacteria first colonize and then they migrate to the pockets. That's why you have recidivism. You treat the pockets and it comes back. You treat the pockets, it comes back, because we didn't look on where it was coming from. Same here, 13, AHI was 13, mild sleep apnea. You can see the porphyrin. Again, I'm looking through with the Velscope on the dorsum of the tongue. You will see bacteria present around the gingival margins with the Velscope, and if you use moleculite, which is not, would be using it off label, but again, still one and the same. You will see a lot of anaerobic orange pathogens stealing nutrients from the host around the pockets. Here's another case, female, 57, a 16-inch neck, Epworth 22, mild sleep apnea. Again, at the AHI at the bottom was founded by a sleep study. Every one of these patients, again, you will see at least if I always tell a patient, if you go have a sleep study and it comes back negative after I showed you the orange, then the sleep study missed it, because the patients have some type of oxygen desaturation process, whether it's during sleep or during the day or both, that caused them to allow bacteria to grow. And now you can see it with your Velscope without sticking with a needle, without scraping their tongue and sending it off. You can see it. And there's also a point of care treatment outcome monitoring device. I had a couple patients at this time, now I've had hundreds, who use CPAPs. And I expected, because of what I saw clinically, that they would have a lot of porphyrin. They still had some, but not to the extent of what I thought they would. At a different time, we'll talk about my thoughts on CPAPs. Or if you have a question at the end, I'll tell you about it. Again, this is a 63-year-old male, 17-year-old necks and heavy porphyrin, and had significant sleep apnea. Mild to moderate obstructive sleep apnea will progress. If you don't treat it from the snoring, in most cases, it's been shown through research to progress to a more problematic situation and the comorbidities related to it. So our job, in my opinion, is early. We have the ability to give patients information. And someone mentioned, I've done this on children, and you'll be very surprised. There is a lot of porphyrin on children. I've had at least 3 patients that I went out and told their mother, and they were under 12. And I said, I'm seeing a lot of anaerobic infestation on the dorsum of their tongue. And some of the things that you might want to look for are symptoms of maybe, when they ADD, or the doctors, or they're not going to sleep right, or they're going to act out. And 2 of the patients of the 3 started crying. And I got nervous. I said, what's going on? Well, these patients were, they were trying to put them on Ritalin and Adderall because they had just what you'll see in patients, in these younger patients. I think it aligns with a lot of the initiatives and research that most of these are oxygen desaturation processes that don't let optimum metabolic efficiency occur. This is happening on the cellular mitochondrial level through the Krebs cycle. Oxygen is the most important catalyst for Krebs cycle to work efficiently. When oxygen, and it's outside the Krebs cycle, we're looking at the Krebs cycle by using nutrients to add to it, but we're not looking at optimization of oxygen to make the Krebs cycle work. We have 40 trillion to 100 trillion cells drawing on nutrients in our body at any one time. And I will tell you, the amount of oxygen in the lungs is 21%. It's not 100%. 78% of the oxygen in the lungs is nitrogen. We do not use nitrogen in gaseous form. So to reiterate, airway patency issues, snoring, when you see orange, think of that they may have an airway patency issue. And it most likely is happening when they're sleeping. And then also then look at the medical history. And if you see certain comorbidities, then you can tie them all together. The trick is to see what others see, but to think what others don't think. And that's what I hope I challenged you with today. You can use these tools. One, it's very helpful to show patients, because the first thing they're going to ask is, how do I get rid of the orange? And that's where your jobs are. Basically, I will tell you that we have to fight the battles with working on the tongue, doing the hygiene every month or more often, but then also giving them information to see if they can change the environment, which is the war. This can be an economic boost to your practice if you want it to be, and certainly things that you know about, you should be able to capitalize on. So it definitely is a one more tool to your toolbox. But the bottom line is we're here, in my opinion, to help people live better and save lives. Again, take thorough medical history, do an oral exam, do everything that you do. If you see orange, then recommend they have a sleep study. Screening for OSA, I can help you with that. The company can help you with that. I love this picture. One of my buddies painted it. It's called the incredulity of St. Thomas, but he's a master painter, and he paints himself into the picture looking over. And I thought that is so cool, because we have doubting people, but as you look into the enlightenment of science, then the good Lord is going to show us the way. And a group like, biological healthcare people like we are, this isn't hocus pocus. Finishing up my program, one of the things that I picked up on, because I have heart disease, is what's called carotid intermedia thickness. In the hands of a dentist or a healthcare practitioner, a hygienist who's trained, and you can be trained in several minutes, you can look at the carotid arteries and the thyroid with ultrasound. And it's kind of like a lifeline screening. It is a screening in our hands. Yes, we can charge for it, but you can send those images with your patient to their medical doctor. And I have, and as I told you, I've had hundreds of patients. I even found thyroid cancer. My best friend, I found thickness. What happens with if you understand the process of heart disease, the arteries get thicker by virtue of lipoproteins getting trapped in the muscle layer. When you look at the carotid arteries, it's a representation of all the other arteries of the body. And I have sent patients, many patients, to their doctors with these images, because most of the time what we would see is calcified plaque, and we'd see it with a radiograph. Calcified plaque is the latent aspect of the lipoproteins in the arteries, and that is a more stable condition. The liquefact process of lipoproteins and bacteria that trap in there are what cause heart attacks, strokes, and Alzheimer's. So an ultrasound uses sound frequency and that produce images. And again, the most recognized is for babies and other things like that, but you can use the echogenicity to show give great images vascularly mainly and of soft tissues. Carotid intermediate testing is what I had mentioned to you about, and thyroids. Carotid artery is right under the cricoid cartilage, and the carotid artery runs right next to it. So if you utilize this technology, and you don't have to do it in your office, I just suggest to your patients, maybe you have your doctor do a diagnostic ultrasound. So that's basically it. I don't know if I ran over or ran not enough. I hope it was interesting enough to stimulate your thoughts. Are there any questions pertaining to what I had said? And I am not combative. Science is challenge. So if you have questions, we throw them out. We talk about it between ourselves, and then progress is made for our patients. Barbara, you got anything going on there?
Thank you. That was excellent, and I thoroughly enjoyed that. And so let's open the floor. I know we have at least one question, and so we can put them in the chat box, and I will go through that. So Janet asked if we could go back to the carotid test 3 slides back.
Yes, we can. Maybe. All right, let me see if I can. All right. Come on, Weisel. Well, don't kill me now. I'll get it. All right. Okay. One more, or Janet, do you want me to right there? Okay. And you can unmute or mute, whatever, because I can't hear you. Okay, good.
That was the one, doctor. That was the one, the carotid intermediate thickness test. I wanted to get the name of that right.
Yeah, CIMT.
Okay. And how much does that unit cost to buy?
A ultrasound is around $5,000.
Okay,
And what I usually charge is around 300 to 350.
for training.
No, actually for the training, if you bought the unit, $5,000, you're going to get the training.
Oh,
But when we charge patients, we charge them, and there are codes for that. In the ADA code, and restructuration is around $300. Now I am moving in a area, since I have a relationship now with a medical oncologist who's an expert in ultrasounds. That's a guy named Robert Bard. He would do reads for us if you ever wanted, because there's a lot of times you'll find practitioners, especially with CBCT. I found pushback, and I've been using CBCT, your three-dimensional or 3D cone beam.
mhm.
But the biggest pushback with that technology was the fear that you were going to miss something. So having an overread by a maxillofacial radiologist or someone like Dr. Bard costs about $90 to the patient. It might be worth doing.
Mhm.
It's not hard to see once you start doing it. It can be, it's pretty easy to find the carotid arteries and the thyroid because they're right there, and it shows. That might be another time where I can, or if you want to call, I can show you. We might go virtual, whatever, and I can show you how we use that. But yeah, a ultrasound is about $5,000, and that includes training.
Okay.
Um,
Well, I have a Velscope. I have a diode laser. So I don't mind spending the money for the technology that's going to
Sure.
help my patients, because I missed thyroid cancer on my sister. And man, it's hard.
Yeah.
It's really hard. I didn't feel anything when I
Yeah.
did her oral cancer, and palpated. So I'm like,
Yeah. What I use is I use my fingers from the clavicle, and I just kind of gently move my fingers like I'm and just kind of feeling.
mhm.
My roommate from college is an ENT in Fort Wayne, Indiana. And I called him, I said, Dave, what should I feel if the thyroid is normal? He said, you shouldn't feel anything. So what you're going to start feeling suddenly, there'll be that right around the cricoid cartilage there. There's just going to be, and you might think it is the SCM, sternocleidomastoid,
Mhm.
but that anything enlarged in that area has to be at least recommended, especially if you see any orange. Just tell them you think there might be some thyroid enlargement. If you're wrong, you're wrong. Hey, but
Right.
most likely you're not.
Yeah, it's better to be safe.
Oh,
And
yeah.
with the Malin-Patty score, screening, do you find that the position is better to be sitting up or laying back?
I do most of my examinations on a kind of what's called Trendelenburg. What is it? Partially laying back.
Trendelenburg.
Right. And I have them stick their tongue out. Now, because I do sedation, it's, or have done, I don't use it as much anymore, but I trained in it. And that helped me with understanding of airway patency issues. And some of these people are gaggers too. When you have them stick their tongue out, they're like, so I'll sometimes say, well, I'm Malin-Patty of 2-3, because I'm not 100% sure, because they're going, you know what I mean? And the same with tonsils and adenoids, because that will show me the three-dimensional clinical representation. So I look at TNA, not in a guy's terms, tonsils and adenoids, and the Malin-Patty. And then
Can you see the adenoids?
you know what? They're all conglomerate together there. So when I anything,
Is it like the top of the tonsil?
yeah, I'm not going to differentiate them out that much. It's all lymphoid tissue. that, in my opinion, is, as I mentioned to Barbara before, that lymphoid tissue at one time, because I do functional orthodontics and orthopedics, I was more orientated just to take them out. But any lymphoid tissue like a lymph node, and especially the tonsil and adenoids, those are MASH units where the immune system takes invaders that they don't have, anything to fight. So they take them there and they dissect them, and then that's where your adaptive immune system then makes T cells and B cells to fight them. So to wipe out a MASH unit, unless the airway issue is a major problem, I don't ever recommend that.
Okay.
All
Can
right,
I
we
ask another question? Have something else, Barbara? Go ahead.
well, is it a fast question, Janet? Because I've got one more question from.
No, go ahead. Go ahead.
Okay.
I'll contact Doc
Yeah.
independently.
Okay, excellent. So we have one more question from Dr. Don Ewing. Do you have experience with Bodyguard 2 by Nerve Express?
Bodyguard 2, obviously I don't, because I don't know what it is. Bodyguard 2 by Nerve Express. Can you tell me what that is?
Dr. Ewing, are you?
Yeah, help me, because I'm doing research on what's called, what is it? Pulsed electromagnetic therapy.
Okay. I don't see Dr. Ewing on, so I'll contact her and you guys can
Yeah,
connect.
please.
She can.
Here's my contact information, 24/7. I hope that was helpful.
Great.
And stimulating at least.
Yeah, it was good. It was excellent. And I look forward to seeing you in New Orleans. And then, maybe we could also just review, a good oral cancer screening with the Velscope as well.
Perfect. Perfect.
So for everybody that is here, just if you'll contact Kim and she can send you your CE credit. If you're listening to this on a webinar, and you have to take the 3-question test and then submit it to Kim. It will be on the IAOMT website under webinars, under the professional member column. So any questions, let me know. And then next month, what I'm planning for our monthly meeting is to go over the microscope use. So, and if you all have more questions on, what else we should be learning about, I am open to suggestion. So I hope that you guys all learned something good today. And
Thank you, Doctor.
Thank you, everybody. I
I'm going to
appreciate
be
you.
calling you.
I look forward, absolutely, anytime. And thank you once again, Barbara, for inviting me, and thank you guys for your attention.
yay, and I appreciate your time, and I look forward to seeing you in less than 2 months.
Absolutely. Absolutely. Stay safe.
Time will fly by.
Bye-bye.
All right. Thank you, guys.
Bye.
All righty. Bye-bye.